It has been said many times, if the problems are in the community, then the answers are in the community. And that is a true statement, because regardless of what side of town we call home, we are all part of a larger community that is connected. And more importantly, we understand that if one facet of our community suffers, then the other communities are impacted as well. Case in point, the recent oil spill, Hurricane Katrina. In each of these circumstances, the devastation left a widespread ripple effect that was felt not only at the local level, but the county, the state, and even regions of our nation. Therefore, in an effort to search for possible answers to long-standing problems like health and economics, members of the Reach Us staff and coalition, along with assistance from Marketry, a local research firm, turned to community members for answers. And these community members were from Wilcox, Marengo, and Jefferson County. And we asked them for their thoughts, their opinions, and their suggestions. And although these three counties may not be representative of every urban and rural county in Alabama, after watching the videos, you will agree that some of their views on health and economics are more than likely shared across all county lines. Many of the leaders that you will see on the video are present in the audience today, and we thank them for sharing their time and expertise with us. So you are here today to continue the dialogue that started in these three counties, and together we can develop viable action plans to address health and economic issues in our great state of Alabama. Following the video presentation, our two moderators will lead us into further discussions. Our first moderator will be Melina Cunningham, who has 23 years of award-winning excellence in broadcast news, and many of you may know her as the NBC 13 news anchor. She is also the president and CEO of Strategic Media Relations. Our second moderator is Dr. David Clark, Dean of the UAB School of Business and the Wachovia Chair in Business Administration. And you can read more of their bios in your program. But now we will watch the video.
Economically, we're a poor area.
You know, there's been an ongoing effort here for years to try to bring new industry here. And overall, we haven't.
Distance from interstates and big highways, that's a big drawback for us.
Why are things going this way?
There are no jobs.
No jobs.
Now we're 27% attitudes.
So it's attitude, people staying at home on the couch.
Right.
Like,
Another challenge is people moving away to seek jobs. We have students who are receiving their education, they're graduating from high school and going on to college and receiving these degrees, but they're not coming back to Wilcox County. There's a lack of skilled labor for our community.
Good leadership, definitely. We gotta have good leadership.
I heard a candidate for sheriff brag about getting so many hundred absentee votes, that he was guaranteed so many.
Well, I had the privilege yesterday of walking upon a representative and a board member conspiring to fire me because I'm against Rome.
We still have two separate school systems. I mean, we have the private school and we have the public school, and that is a problem for this area.
The churches. The churches have become a divider.
All those things in churches, but we're not teaching those that because now they are becoming houses of class, social class and grace.
You got so many good things going on here. I love being here, but it need to be shared vision.
it's not so much the racism amongst blacks and whites. We still have whites races and we still have black races, but the racism between us.
Well, we have to stop with the we and the they too. I mean, I keep hearing we, they, black, white. There is no we, they. We're all one people.
%27% unemployment in this county.
Weyerhaeuser was running, they closed down.
People reach the point of they're just trying to survive.
That's all.
Right.
Well, we have people that choose between losing their homes, which their entire family, or going and seeking some help medically.
If you lost your job and there was no hope of getting one, how stable would you be a year from now? Not so stable.
A lot of them turn to alcohol or drugs.
But cancer and HIV are prevalent, and I have to speak for them because that's the environment that I'm in every day.
Right.
But again, the question becomes, where do they go? I can count on less than one hand the doctor's office, the health department that are available to treat people.
We have a hospital. It's small, but it is essential to our community. For a while, they were doing mammograms here, and that was a big help for a lot of people. But now that machine has to be recertified or something, and they don't have the technician, and it costs some money to have that recertified.
I work with women all the time about getting mammograms and pap tests, and they have a fear of what they will find. Right. So, to keep from finding anything, they won't have it done. Right. So we have to educate the people that it's better to find out early what they need to do than to find out later, and that's what it is.
The higher the socioeconomic level of a family or a community, the more they are likely to be involved in health education and awareness of what they should be doing, exercising, diet, and they can afford more things.
If I had $1 million to make a difference in our community, I say that $1 million I would contribute toward workforce development in the area of training. In my opinion, workforce development equals revenue and income. Revenue equals community growth. Community growth equals better resources for our citizens, to include parents and children and our seniors. Better resources produce high school graduates or higher. And that equals maintenance of working people in your community, which would generate a cycle of continued progress.
I'm on the same with her, except I divvied it up with half of it to creating jobs, options for employment first off, because without those jobs there, training, what good is it going to do?
And another thing, I think we need an assisted living place. It's so many people that want to go or need to be in assisted living, and look at the jobs it would create.
Well, of course, part of it's going to the hospital. Right. You probably could have guessed that. And then part of it I would take to encourage, as an incentive for a business to come here and start up. I see Camden as developing into a great area for people to come and enjoy the river.
There are models around the country where tourism, we are within a drive distance from Atlanta, we're in drive distance from the coast.
They've come from 49 states and 30 foreign countries to Camden because of our art also. So with the river, I think that is one of our best resources.
If we allow our local people to be able to have some contribution, I think we'll raise the expectation level, and we will also raise the appreciation level. And I think you'll see something in this community. And I think as Wilcox County grows in the Black Belt, the entire Black Belt will prosper.
Demopolis was a river town. There were a lot of merchants. It was I guess you could say, a middle class town. It was founded first by French Napoleonic exiles, so that was kind of different from some of the areas in the state.
In 1965, in almost every city in the Black Belt, you had private schools that were formed and thrived, and the public schools became almost all black.
The majority of the people in Demopolis decided to say, let's just make our school system good. And so they stayed and they worked, and here we are.
In Demopolis, the private school never took off. The public school became integrated. It was really the only integrated public school in the Black Belt.
You've got a group of people who may not agree on everything all the time, but they agree that, number one, we got to make this work. We're in it together. So the school system, education, and health are things that we have here that maybe some of the other communities around us just don't have.
We have a very strong learning community in Marengo County.
The more education you have, the more you're able to change paradigms.
We have been able to withstand a lot of the deterioration that some of the other communities around us have had. We've got a good industrial base here.
We have 3 paper mills within a 45-mile radius.
Industries that are interested in our proximity to the river.
Yeah, you go up to Tom Bigby, and you could ultimately wind up in the Great Lakes.
Unemployment here now, I think it's like 14%, which is horrible.
We did have, unfortunately, they just made an announcement that they were consolidating their plant here back up into New York. It was New Era Cap Company.
That's a blow to us. We're losing 315 jobs, I think it is, or 351.
This area is getting more and more age because the younger, more professional people are leaving for opportunities elsewhere.
What's happened over the last 50, maybe 60 years? We don't have as many people here, as we once did. I understand that we were in line for a major plant. When the guy from another country flew over and he's looking at the nice flat land in the area and he's right close to an interstate, he said, that's great, but where are the people? Because all I can see is trees. How am I going to get 3,000 people to come work at this plant?
The higher the economic development or the more prevalent, well-paying jobs with benefits are available in a community, the more healthier the community is.
One thing that we are keenly aware of here is not only are we the medical provider in town, but as an employer, what impact we have here. The economic impact of a doctor's office in a rural community is about $1 million.
At City Hall, we've got maybe 105 employees. 9 can afford family health care coverage.
Well, a lot of people, if they don't have insurance, they put off going to the doctor. And then that leads to a situation where they compromise their health in a larger way and end up in the ER.
The majority of black people are poor. And that's why they go into the local doctors. That's why because they can't afford to go to, they don't have transportation.
That's why we've chosen to take our outreach out of the hospital and get it into what's usually the social center of a rural area, and that's the church of the school.
The lumber company, they went from about 450 down to about 90 now. Give that many.
They laid off all those people at one time, and then they went through the process of bringing folks back. But the people that they brought back were Hispanic workers. They were here on visas primarily, so they were temporary anyway. They're going to leave in 3 or 4 months.
And that impacts our health care delivery system because they come there for the indigent care to have their babies.
The biggest problem we've got is demographics. You really need to be able to deliver about 700 to 800 babies a year to have a viable obstetrics program.
We deliver over 300-something babies a year.
And we're on track to be about 270 this year.
But we need to be delivering about 400 to not lose as much money. Most of our white citizens, because the perception is I'll get better health care if I go to Tuscaloosa, Northport, most of them are choosing to go out of our area.
And that would be terrible if we lose our labor and delivery service. I agree with you.
So when we do entertain closing it down, there's going to be an uproar, and those that least can afford it are going to be hurt the worst.
There's no place around that you can go. There would be a health crisis, yes.
I'd use my $1 million just for people to have access to health care without having to worry about how they're going to pay for it.
If we had that $1 million, I could see 1 or 2 health clinics where, you know, it's free to those that come in.
Provide additional funding for the treatment of mental health issues.
Scholarships in the medical field for high school students, you know, low to middle income families, come back to the community that they live rather than going somewhere.
The technical field, if we could continue to expand that at our higher education center.
A community health care facility which has a pool, you know, access for gym equipment for all ages, a nutrition center.
I would spend part of this $1 million educating the community, because if you've got good facilities, you've got good doctors, well, you're going to have to inform the people first.
I just put educate the leaders. Just keeping them up to date of what's going on or what's available so they can pass on to their community.
I put research, find out what worked in other similar communities and just researching.
I think maybe a healthy community is a community that has moved from the awareness stage, that's where you have to begin, and has gone to the accountability stage. You know, we know lots of things, but to be aware is not going to create a healthy community, taking actions and being accountable.
I would love to see Demopolis as a retired Mecca community of retired educators. I think what that would do, man, you get some educated folks in the community, you know, they've retired, but they're not ready to just sit on the porch all day. They'll get active in the community. They'll get involved in arts. From the financial standpoint, these folks are retired, so we know they got an income stream, the talent level, and just the fact that we'd have some new ideas coming into town.
Birmingham sits in the heart of the Southeast. We sit in the heart of Alabama.
Well, from a county level, we have, you know, it's just 2 different worlds. You've got this side of the mountain and the other side of the mountain. Substantial differences in health between both. Also substantial differences in economy.
You see buildings closing, businesses leaving, abandoned homes.
We have valuable historic housing stock in Norwood, but unfortunately we have a lot of those homes are unoccupied.
We're doing a study right now to identify what we call food deserts. Those areas are locations or communities that don't have adequate grocery stores to provide fresh foods and vegetables.
And I think we really need to clean up our communities to make them, to help revitalize them so people will continue to live.
In communities today, many of the communities, we don't know each other. We don't care about each other. We allow things to occur in our community without questioning them. You know, and it's okay for drugs to be in our community. We need to go back to a community where everybody cares. You got to start somewhere.
Yeah, but we've been starting somewhere for the last 25 years.
So then you go back to what this gentleman said, there's no hope. So you got to have hope, and you got to start somewhere.
The hope is that, you know, a lot of people say the system is broken. It's not broken. It's been working fine.
It sure is.
For somebody. So when we move out of the neighborhood, they'll say, well, you're leaving because you don't have this. You're leaving because you don't have good education. You're leaving because you know, the crime. You know, you got to stay and fight.
There's a community called Fountain Heights that's a part of Birmingham. 10 years ago, I met with a group of residents who indicated that they hated their community. They wanted to find ways to move out. We began to develop redevelopment plans for the area, and we had the residents get involved. Just this past Christmas, I went up for their Christmas luncheon. People there were saying, we love our neighborhood. We're excited about the things that's happening here.
I mean, I really don't know which comes first. Is it economic well-being that leads to health, or is it health that leads to economic well-being? There's no question they go together.
Poverty causes a lot of problems with health care in general. The emergency room was used as a first-tier health care provider as opposed to being able to go to a doctor.
All that's gone because of economics. We can no longer find those little community places, so they close them down.
We will never have a healthy community, non-neighborhood, until the zoning laws be changed.
Exactly.
And as long as the zoning laws are like they are now, we're going to continue to have liquor stores. We're still going to have abandoned buildings.
We need to address environmental safety. You know, can we make the community safe to live in?
Pollution is a problem.
We've done a really poor job with nutrition and physical activity.
There's not enough knowledge about what the essentials of a healthy lifestyle are.
It drives me crazy that what we're dying from today are preventable diseases.
The first thing I would do is have UAB start a grocery store chain to add some competition to these other grocery stores.
A grocery store where I could train in a training program where the youth could train to work in this store and probably later on own the store.
Created social entrepreneurs. You know, there are a lot of small business people who have great ideas but not a lot of resources. So I like to invest some of my money back into those small businesses to get them to a place where they can sustain themselves.
When you draw a 500-mile radius around Birmingham, we touch 15 major cities and hundreds of other mid-sized to small cities. That gives us an opportunity to attract those industries that are building green products to say this is the place you need to manufacture your goods and items, and that gives us the opportunity to create industrial parks and things of that nature to act as a component to attract those businesses into this area.
We also would have restrictions that would require those businesses to be invested and located in the community.
Financial literacy for families, scholarships for community service, and particularly in health education.
Start a health clinic because, you know, you got to have a healthy body in order to have a healthy mind.
I built a community center. I have it set up for for the younger students to come in and learn and train. Also, I would have a job skill program. I also put some of those programs into the high school. So when we build school, put some vocational classes there where they can learn.
I'd spend it on the process of bringing the county together. It's sort of like a planning grant.
And I think the key is getting people involved to have a sense that they control their own destiny. We determine who we are, how we live, and those things that we bring into our community and those things that we move out of our community. That's when you build hope back into a neighborhood or a community.
So I'd like to start out with a question. You've seen the videos, and my question is, does better health have to wait for the economy to improve? Now, that is a serious question to consider in light of the poor health that too many of Americans face today in today's unhealthy economy. And I'm thankful that I get to ask the questions and I don't have to worry about coming up with the answers. So we're going to start early on this cold, well, not quite cold, but rainy, dreary Friday morning. We're in a kind of a dark and mood-lit room, but we want to get you invigorated first off by coming up with some dialogue. So let's start with this question. Anybody feel free to start commenting on this question, especially in light of what you've seen on the tail of the 3 different counties that were highlighted here in Alabama. So, does better health have to wait for the economy to improve? Don't be shy.
No, it does not.
And why not, Mr. Loader?
If we invest our dollars in good health care, we can all get good health care. But if we think about the idea of making the dollar and keeping it, we'll all be in the same boat we're in now.
One of the comments that Dr. Partridge made in the video was talking about in Marengo County 40 years ago, 1965, they segregated all of the schools. You had all these private schools spring up, but when they realized they could not sustain themselves, that county ended up becoming the one county in the Black Belt that had total integration in the schools. So of course, as we all know here in Alabama and throughout the Deep South, 40 years ago, the big issue was race relations and segregation. But now that we are all in the same room and can talk, what role is race possibly still playing in the poor health and the economy in certain communities?
There's got to be a direct correlation there with the segregated school system versus an integrated school system. What it tells us is we can't live apart. We're not strong enough to live apart. Yesterday I attended a summit hosted by NH Corporation in Wilcox County, and they were bringing people together, dialogue. And I left there with a sense of we're making some progress, because until we start looking at ourselves regionally and how it impacts the entire region, how it impacts the state of Alabama, how it impacts this country, we're not going to make any progress. So these segregated schools are not going to be an entity that's going to help us progress, or at least keep up with the progress that we must make in this country, in the Black Belt of Alabama.
Well, you make a good point. You talk about that there is now dialogue between the races. So now how do we push past the dialogue and get into action? That is the big issue.
I tie all this back to Hope 6. Hope 6 was developed to actually work with, I guess, disadvantaged or poverty level residents downtown. When they cleaned up that area, they dispersed those people out to the suburbs. Now we have food deserts. Businesses moved away because the crime increased. So when you tie all that back, not just to Birmingham, Alabama, you tie it back to Atlanta, Georgia. You tie it back to Detroit. You tie it back to Washington. The same thing happened in all those cities. And it started with Hope 6. So now you have a food desert. Not just look at what happened, but you look at what caused it. So those are the things that we're looking at. You know, it's just a side effect of a project that went bad.
One of the things I think when it comes to race that we have to realize is that racism is better, but it still exists. That's the key. Is that sometimes we want to really be convinced, really convinced that it's gone away, but it has not. And the thing is that's okay. The key is being honest about it. So nothing can be corrected until we begin to operate with integrity about where we really are. We're not going to move until we face the fact we are wrong about some things. We spend a lot of time proving how right we are, but we need to spend some time proving how wrong we are. Because until we face where we're wrong, we can't change a lot of the processes and policies in order to move forward because the times have changed. The second point that I want to make is that it is very critical that when we are making decisions, regardless of what positions that we're in, we have to begin to go to the people that are impacted. The higher up we are, and I can even say me. The thing is that I really don't know about being down there and in the trench right now of the hardship of having to deal with some things because I'm not there. But yet, so many people who can't even relate to it are part of the decision-making process. But how can you make so simple? You don't even have the experience to operate with it. How can you tell me that I haven't been discriminated against when you're not me? That's the thing. And so we've got to begin to go straight down to the people that are being impacted that we are trying to help. And thirdly, my point is actively listen. Stop nodding and acting like you're hearing. Listen, and really hear. Really hear what's being said. And don't think you got a comment. Just simply take what's said and say, you know what? That was a point. We hadn't thought about it that way. And begin to incorporate everybody in the decision-making process. And I think then that's how people can move to begin to feel like on the right thing. So that's my thought.
I think that she's absolutely right, that there's an invisible barrier that we look at it and don't see it. You understand? Even among black and pro-black, you understand? That they look at each other, but they don't identify no more. And many times, those who are in a position to help us overlook us. You see, and I think that once we begin to see the value of a mind, even a mind that's in a cook, of the mind of a Johnny, you know, that has the ability to take that janitor job, make business out of it. Or to take the housekeeper job and make a business out of it. Of a car wash and make a business out of it. You see, that's when we begin to identify the root cause of the problem. I remember when I first met Dr. Parcher, many, many moons ago when I was a child. He brought out something I had never really thought about, which is poverty. The sickness of poverty, being poor. Being poor is a killer. You understand? And I don't care what we say about it, we got to address poverty and then bring the area of the byproduct of poverty is death. You know, sickness and depression and all those things coming about in our personal lives, in our community, because I'm broke. And I can't buy nothing what I want to buy, even when I'm strong and healthy. I die early. You know, because of those areas. You thought I forgot to get it. Thank you.
At one time here in the city of Birmingham, you had Pacifico, you had TCI, all of those industries creating a system of medical welfare for the people. So when those jobs were gone, the economy failed, healthcare failed. At one time there was facilities all throughout all our little satellite communities for healthcare. They're no longer there. What happened? So now the government can't afford it, the cities can't afford it, so all of us are caught in that vice of no health care. Whether you're still poor, it doesn't matter, whether you're black or white, you don't have health care. So what are we going to do? And this is the key. I was sitting listening to the pastor at the end. If you can't afford it, what system is going to create it? I'm looking at all these people. I said, all these great minds are here. We got to be creative. Let's get some mobile healthcare units to go out into these communities and see about the welfare of the kids getting their immunization shots and things. We're not, you know, kids in the first grade got to have certain shots. Parents can't afford it. What do? They line up different little places. We got to be responsible for those people. And I'm hoping that when we leave here today, I heard the gentleman say 3. I hope that we can get 1, that we see that those buses go out to the communities and take care of the kids.
You brought up an interesting point, and it was also brought up in one of the videos where there was a city council person who mentioned that there were 109 employees at City Hall, and less than 10 of them could afford family health care coverage, which almost, I guess, is like the working poor. So as we all know, you have to have a healthy workforce in order to keep the economy going. But if you have people working who can't afford the health care, what does that mean for business? Was that my bell to stop? Oh. Okay, I just got to be. We'll keep the dialogue going. Thank you very much.